Teresa and I watched Obama's speech to Congress last night. For the most part, I liked it. Several parts I absolutely loved. There was at least one part that I disliked, which was the mandate to purchase health insurance. So I'll start with the part that I disliked. So Obama said his plan will require people to purchase health insurance.
Even if we provide these affordable options, there may be those, especially the young and the healthy, who still want to take the risk and go without coverage. There may still be companies that refuse to do right by their workers by giving them coverage. The problem is such irresponsible behavior costs all the rest of us money. If there are affordable options and people still don't sign up for health insurance, it means we pay for these people's expensive emergency room visits. If some businesses don't provide workers health care, it forces the rest of us to pick up the tab when their workers get sick and gives those businesses an unfair advantage over their competitors. And unless everybody does their part, many of the insurance reforms we seek, especially requiring insurance companies to cover pre-existing conditions, just can't be achieved. And that's why under my plan, individuals will be required to carry basic health insurance, just as most states require you to carry auto insurance.
Okay, so first, the analogy with auto insurance is similar, but not exactly right. The difference is that I can choose not to have auto insurance. I know auto insurance is mandated, but so I can choose to either not drive, I could ride a bike to work, I could take public transportation, etc. So the auto insurance is only mandated if I choose to drive on the roads. So the analogy doesn't hold up with healthcare insurance because my choosing not to drive on the roads is me dying. Meh. I agree with the premise that those without coverage will still rely on the ER and get treatment later than they should and therefore cost more to cure. But I'm a fan of a single-payer system, which would just inherently cover everyone and everyone would chip in. But this is different. The problem right now is that the insurance companies are taking advantage of people. Okay, creating a mandate that everyone needs to purchase health insurance just gives them more power over us. It doesn't solve the problem. So insurance companies need to be afraid that they're going to lose our business. But if the government is mandating that we get insurance, that gives the insurance companies far too much power. Okay. Now, this is tempered by his strong support for a public option, which he describes here.
Now, I have no interest in putting insurance companies out of business. They provide a legitimate service and employ a lot of our friends and neighbors. I just want to hold them accountable. And the insurance reforms that I've already mentioned would do just that. But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear. It would only be an option for those who don't have insurance. No one would be forced to choose it. And it would not impact those of you who already have insurance.
Okay, I don't like the mandate that we need to purchase insurance, but I will be willing to compromise on this issue if and only if we get a strong public option. Okay, without a strong public option, the mandate will make the system worse because with the corrupt insurance companies won't need to improve their product because why should they? We're required to buy from them, and that's not okay in my opinion. So what worries me about this proposal is the possibility that the bill will start as Obama describes it, but that the public option will be stripped away while the mandate is retained. That possibility would be the worst of all options, and that includes the status quo. Okay? In my opinion, it would be better to do nothing than it would be mandate purchase of insurance without a public option. Now granted, he said that there would be a hardship waiver, so those who are simply too poor to buy the insurance can be exempted. Now, while that prevents putting undue burden on the poor, the rest of it still gives too much power to the insurance companies, which are the very core of the problem. So, meh. I'm worried. All right. So, let's move on to some of the parts of the speech that I did like.
One man from Illinois lost his coverage in the middle of chemotherapy because his insurer found that he hadn't reported gallstones that he didn't even know about. They delayed his treatment, and he died because of it. Another woman from Texas was about to get a double mastectomy when her insurance company canceled her policy because she forgot to declare a case of acne. By the time she had her insurance reinstated, her breast cancer had more than doubled in size. That is heartbreaking, it is wrong, and no one should be treated that way in the United States of America. We are the only democracy, the only advanced democracy on earth, the only wealthy nation that allows such hardship for millions of its people.
Yes, thank you. I just don't get it. How people can look at the system we have in place and claim that it's okay or that we have the best healthcare system in the world. I mean, the United States totally rocks your face off in many ways. But when it comes to healthcare, we are embarrassingly behind the curve, okay? Now, we as a nation have the intelligence and the resources to change the way we care for our people and once again be the best in the world. But do we have the compassion and the will to pull it off?
But what we've also seen in these last months is the same partisan spectacle that only hardens the disdain many Americans have towards their own government. Instead of honest debate, we've seen scare tactics. Some have dug into unyielding ideological camps that offer no hope of compromise. Too many have used this as an opportunity to score short-term political points, even if it robs the country of our opportunity to solve a long-term challenge. And out of this blizzard of charges and countercharges, confusion has reigned. Well, the time for bickering is over. The time for games has passed. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.